Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Please see additional important safety information at the end of this video.
When I first speak to providers about tardive dyskinesia, or TD, I'll ask a couple of simple questions. How often are you diagnosing TD in your practice? Do you think that your patients are affected by TD? When I ask these questions, providers often respond with, "I don't see TD very often." I'll say, "Are you sure?" When they say it doesn't bother my patients, I'll say, "Have you asked?" In my experience, TD is vastly underdiagnosed and undertreated. I'm Bryce Reynolds. I'm a psychiatrist currently working with an ACT team based in Durham, North Carolina. I treat patients who have serious mental illnesses such as schizophrenia, schizoaffective disorder, and bipolar disorder. About 90% of my patients are on first or second generation antipsychotics, which means that they're at risk of developing TD. In my 30 years of practice, I have found a number of techniques to help identify and diagnose the movements of TD. Today, I'm going to share some of the techniques that may help you in your practice. When first working with our patients, there are 4 domains we're used to looking at: positive symptoms, negative symptoms, cognitive symptoms, and mood symptoms. I argue there's now a 5th domain: movement symptoms. Involuntary movements can have a major impact. A full body evaluation should be included when we're working with our patients. I believe that these 5 symptom domains can seriously affect our patients. Antipsychotic medications have been out for over 65 years, yet there was no approved treatment for TD until 2017. When the first VMAT2 inhibitor was FDA approved for adults with TD, I soon saw that the symptoms were exhibited by far more patients than I previously thought. However, if TD assessments are only done by the provider, then it becomes very limiting. Providers typically have a very short amount of time with each patient, 15 minutes or less. They often feel that they don't have the time to assess for TD, much less the time to address it. Despite the challenges, it's important to assess for and address TD. Practices can identify abnormal involuntary movements by making this a team effort. Who is the most likely person to see the involuntary movements of your adult patients? Not a clinician. In fact, it can be your front desk staff member. If anyone who works in your office identifies a movement, they should pass that information on to the nursing staff. I also recommend that your team go through their caseload and write down the names of all the patients who have movements. Any kind of involuntary movement should be noted. Then that patient can be evaluated further by the nurse or provider to assess the type of movements the patient is experiencing and make a differential diagnosis to confirm TD. When the team has a list of patients in front of them, they all have a role in identifying movements. This new mindset in your practice becomes a complete team effort and comes across naturally to your patients. As providers, we're used to evaluating patients on antipsychotics for drug-induced movement disorders. In my personal experience, having a treatment for TD has made me much more aware of involuntary movements. I recommend assessing patients on antipsychotics even second-generation antipsychotics for TD at least every 6 to 12 months, and more frequently if they have a high risk for TD. If a patient is already on treatment for their TD, I assess their movements every time I see them. I'll first start the conversation by asking my patient, do you notice any abnormal body movements you can't control? Most patients will say that they're not aware of any movements. After a complete assessment to rule out other movement disorders, and once TD is confirmed, you need to ask questions that are specific to TD. Patients may answer your questions about their general well-being, but they may not be talking specifically about how TD has affected them. So I've started using an established technique called motivational interviewing. Motivational interviewing is an evidence-based practice often used for conditions such as substance abuse. Using this technique to talk about TD with my patients has helped me have more productive conversations with the goal of getting them to acknowledge symptoms and consider treatment options.
Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Contraindications. INGREZZA and INGREZZA SPRINKLE are contraindicated in patients with a history of hypersensitivity to valbenazine or any components of INGREZZA or INGREZZA SPRINKLE. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, including cases of angioedema involving the larynx, glottis, lips, and eyelids, have been reported in patients after taking the first or subsequent doses of INGREZZA. Angioedema associated with laryngeal edema can be fatal. If any of these reactions occur, discontinue INGREZZA or INGREZZA SPRINKLE. Somnolence and sedation. INGREZZA and INGREZZA SPRINKLE can cause somnolence and sedation. Patients should not perform activities requiring mental alertness, such as operating a motor vehicle or operating hazardous machinery, until they know how they will be affected by INGREZZA or INGREZZA SPRINKLE. QT prolongation. INGREZZA and INGREZZA SPRINKLE may prolong the QT interval, although the degree of QT prolongation is not clinically significant at concentrations expected with recommended dosing. INGREZZA and INGREZZA SPRINKLE should be avoided in patients with congenital long QT syndrome or with arrhythmias associated with a prolonged QT interval. For patients at increased risk of a prolonged QT interval, assess the QT interval before increasing the dosage. Neuroleptic malignant syndrome. A potentially fatal symptom complex referred to as neuroleptic malignant syndrome, NMS, has been reported in association with drugs that reduce dopaminergic transmission, including INGREZZA. The management of NMS should include immediate discontinuation of INGREZZA or INGREZZA SPRINKLE, intensive symptomatic treatment and medical monitoring, and treatment of any concomitant serious medical problems. If treatment with INGREZZA or INGREZZA SPRINKLE is needed after recovery from NMS, patients should be monitored for signs of recurrence. Parkinsonism. INGREZZA and INGREZZA SPRINKLE may cause Parkinsonism. Parkinsonism has also been observed with other VMAT2 inhibitors. Reduce the dose or discontinue INGREZZA or INGREZZA SPRINKLE treatment in patients who develop clinically significant Parkinson-like signs or symptoms. Adverse reactions. The most common adverse reaction in patients with tardive dyskinesia, greater than or equal to 5% and twice the rate of placebo, is somnolence. The most common adverse reactions in patients with chorea associated with Huntington's disease, greater than or equal to 5% and twice the rate of placebo, are somnolence, lethargy, sedation, urticaria, rash, and insomnia. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA SPRINKLE are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZAHCP.com.